Hello, everyone. My name is Jonathan Aja. I am the CEO of Large Agriculture and the Chief Scientific Officer. And today I'll be having a quick talk on diseases of the African catfish. I'll look at preventive measures, diagnosis, and treatment. Now, the reason why this is important is because I've not been able to find any authoritative scientific discussion of this matter, at least across the Nigerian catfish farm community. And as an investor and a businessman in the sector, I thought we needed to, address this. So we're going to use this outline definition scale of the problem classification. I'm going to classify them by the causative agent, morphological appearance, how they look when they have the disease. We're going to look at it via stages, when this disease caused, from archery to broodstock. We're going to look at diagnosis, first aids, and treatment measures, biosecurity and preventative measures, summary, and we're going to conclude. Now, with that said, let's get started. What's the definition of the disease of the African catfish? Simply means when you have a pathological condition that's an abnormality away from what it should be. And this could result from infectious reasons, so bacteria, viral, fungal, or parasitic, or non infectious. So, for instance, environmental, nutritional, or management related, which causes an impairment of the normal function of the fish, leading to failure in growth, survival of the fish, either in an aquaculture setting or a natural habitat. With that said, the FAO has also defined fish disease broadly as abnormal conditions of body structure or function that impairs their normal activity. Now, what is the scale of the problem? Quite big. Now, just to put this into perspective, Nigeria happens to be the most dominant aquaculture uh, producing country of the African catfish in Africa. Now, with that said, the African catfish is the most popular species. Therefore, diseases affecting it significantly affect the fish farming industry in Nigeria. Now, just looking at data that come in nationally across Nigeria, bacterial infection mainly from Aeromonas hydrophilia, there's a prevalence of about 19 to 25%, meaning 1 in 4 fish, and greater than 50% in pond water. If you put this into context, that most of the fish farmed in Nigeria is farmed in ponds, the trampoline ponds, concrete ponds, earthen pond, this is pretty disturbing, and therefore there needs to be thorough understanding of this by farmers. Parasitic infection is also a problematic thing, looking at trichodyna, dactylogyrus, and gyrodactylus, affecting about 30 to 75% of stocks. What's the average mortality? Anything between 2 to 20% per production cycle. It means about 1 in 5 fish will be lost to outbreaks. This likely exceeds this in my experience and the farmers that I have. So in poorly managed farm, this is a significant problem. Now, just to highlight here, poor biosecurity, overcrowding, poor water quality, you know, worsen this problem, leading to what multi-resistant bacterial strains. So it's important to say there's still no proper coordinated surveillance and diagnosis of this problem across Nigeria. What you hear is a lot of unscientific discussion on Facebook, Twitter, and the other social media by people that had not spent time to do the necessary research. So, what are the common agents? So, let's look at classification by the agent. So, you look at bacteria, viral, fungi, parasitic, nutritional, and environmental. And the most common agent, as you can see, bacteria is Aeromonas and Flavobacterium culminar. And then you have the viruses, which is rare. You have fungal, which is the Saprolegnia. And then you have the Ictotyrus multifilus for parasitic, and you have the Trichodyna, like I've said. Then you have vitamin D deficiency, poor feed quality, and ammonia or nitrate toxicity, especially in earthen ponds. Now, when you look at the description, you would have seen this um, a lot among across fish farmers in the country. So you have ulcer, fin rot, swollen bladder, septicemia, and the various changes that I have described here on the table. Now, if you go to the morphological classification, which is probably the most useful in day to day, ulcerative, you have all of this open sores, necrotic skin, you have sort of like peeling, and what causes that most commonly is bacterial and fungal. So you have Aeromonas and Vibrio as well as Saprolegnia. You have hemorrhagic, which is bleeding, and you would have seen people showing that on social media. So you have red patches, bleeding fins or eye. Again, this is from bacteria septicemia, from Aeromonas, or remember the bacteria we talked about before, Flavobacterium culminae. So cutting type of looking, that's a saprolegnia, is a fungal infection, cystic or nodular, where you have the swelling. So again, here is the dropsy or the swollen belly or swollen stomach, very common again in Nigerian catfish. You have slimy and coating, as well as skeletal deformity. You have the cracked head, the bent spine. I'll show you pictures. So it can happen via stage, so from hatchery to broodstock. So again, looking at this table, it tells you what to expect at different stages. So in the egg stage, you can have fungal infection, bacterial contamination. Larval and fry stage, you can again have bacterial infection, protozoal. And then the fingerlings juvenile, you can have bacterial, especially Aeromonas septicemia. And then you have the adult stage where you have again bacterial infection, chronic stress, broodstock, especially you begin to see intestinal internal parasites. So it's important to know just about what disease can affect different stages, especially if you have the full spectrum of farms, archery to broodstock, grow out, and things nursery pond like we do. So the ulcerative, this is what it looks like, and quite common sighting you can find. The open sore necrotic lesions is oftentimes from Aeromonas, Vibrio, or Saprolegnia. And we'll look at how to treat this. And then you can have hemorrhagic type of lesions, oftentimes from bacteria. Remember the bacteria I've talked about, Aeromonas hydrophilia and Flavobacterium culminae. And this is what it would look like when you assess the external fish and the internal fish. This is quite rare, but this is what it would look like when you have a Sabroneglia. If you look at the gills, you would see these small whitish things. Very rare. This is quite common in the Nigerian space. Swollen stomach, very, very commonly from bacterial infection, swollen stomach, cystic or nodular, and you can see that also internally. Occasionally, it's caused by parasites, but that is more in the broodstock stage. Slimy coating, again from protozoa, not very common in our environment, but this is what it would look like if it were to happen. Another common part is the track head deformity. You can see the track head, meaning the skeleton is not well formed, and you can see that here. And then you can see the bend deformity. All these usually are from nutritional or developmental. They tend to happen when the fish are fed usually poorly formulated feeds or fed just a single type of feed. Usually that's the case. In a well proper formulated feed where vitamins are adequate, especially calcium, phosphate, and vitamin C, this wouldn't be the case. But we have farmers practicing all kinds of things, and you can have this deformity, meaning the skeleton doesn't develop properly. Again, what is the diagnosis? So there are about six things that one you observe. You can do microscopy, bacteriology, parasitology, water quality testing, histopathology, and postmortem exam. For most farmers, it's probably, you know, clinical observation, yeah, and water quality testing and postmortem exam. That especially for small, medium scale farmers in Nigeria. Now, if you look at this note, it tells you specifically the things to look for. I've shown them in the pictures. I don't want us to spend too much time. Now, if you have the facility, you can do microscopy and you should be able to look for what you would find. Bacteriology, you can stain in agar and culture the bacteria. And then in parasitology, again, requires wet film. And then water testing, you can do more or less with the strips that is available. For this level, you would need someone that is trained, either a vet or someone in with the right expertise in fishery and right scientific support for your farm to be able to pin down. But when you do look at the postmortem, you assess some of the things that I've shown in the pictures, you can confidently make the diagnosis. Now, what are the things you should do immediately when you see this? The first thing is you try to quarantine. So you isolate the stock. You need to immediately improve water quality. So you change either, if you can't change all of the water, change at least 30 to 50% of it. Remove waste and uneaten food immediately. Then you need to quickly stop feeding temporarily, because fasting would reduce ammonia buildup and stress. And then you need to do salt bath for 2 to 3% salt dip for 5 to 10 minutes, or 0.3% continuous bath to reduce external parasites. And then ensure proper aeration. You can use chlorine disinfectant for the other things you use in the farm, or iodopor solution. Again, use this only if you have the right training and expertise so you don't poison the fish. Then you observe daily. Keep records of what mortalities, behavior, lesions seen before further treatment. Again, this is specifically what to do. So when there's bacterial, there is, of course, the use of antibiotics. Common in our setting is oxytetracycline, which is fairly available. And others you can use is fluphenicol, you know, which is similar to chloramphenicol. For fungal, which is the saprolegionnaise, you apply salt or approved antifungal bath. You can use malachite green, yeah. And then parasite, again, salt bath is effective. You can use formalin bath, yeah. Then dropsy, again, bacterial infection, treat with salt bath, and then you can use oxytetracycline. Like I said, is quite um, accessible. Then, if you have nodular lesions, sometimes you may need to sacrifice those fish immediately. And deformity here, like I said, uh, it is feed related. So you need to feed your fish with proper. If you are formulating yourself, make sure you have someone that has expertise that understand fish formulation before you use those. So biosecurity are, of course, measures to prevent the introduction, establishment, and spread of infectious agents within and between fish population. Um, so if you look at the African catfish, poor biosecurity is one of the most common reasons, because there's poor understanding of this by staffs and people that manage fish farms, as well as people coming to work in fish farms as well. But key principles is one, you want to exclude pathogens from entering the farm. So that's called external biosecurity. Prevent spread within the farm, that's internal biosecurity. Minimize persistence and in reinfection after an outbreak, that's sanitation and disinfection. Again, a few things to do. Source control, you want to obtain your fishes from certified disease-free hatcheries. Quarantine all new and returning stock for at least 14 days before mixing. Use pathogen-free water. And then farm access control, restrict visitors. Yeah. Use designated footpaths with disinfectant. Provide separate clothing, boots for staff. Prevent movement of animals and birds. Disinfect nets between use with chlorine. Assign separate tools for each pond to avoid contamination. Maintain dissolved oxygen greater than 5 milligram per liter. Bring ammonia down. Carry out 20 to regular water exchange. Remove uneaten food. Now, in this last part, that's where the principle of aeration comes in. The number of aerators that you need to buy. I don't think you can easily do intensive fish farming or semi-intensive farm without aerators. So again, use high quality feed. We've explained this, formulate them properly. Health monitoring, inspect the fish, record mortality. Record keeping is important, daily, weekly, monthly. And then remove or bury or incinerate dead fish. Never discard carcasses or waste into natural streams. Again, disinfect after harvest, you know, disinfect pond, record keeping. Can't emphasize this more than necessary. They are probably preventive. There's no vaccine for the African catfish as you have, for instance, for chicken yet, but research is ongoing looking at vaccination against bacterial disease, Aeromonas hydrophilia. There's the role for probiotics. Some farms use it. So the Bacillus subtilis, Lactobacillus species, can help improve immunostimulants, so natural extract like garlic, ginger, or big gluten to enhance fish immunity. Parenting an early response for fish showing illnesses. So, what's farm level? Remember, prevention is cheaper than cure. Routine monitoring of water, capacity building, training staff, which is what I am doing as the head of the company for all of our staffs, collaboration with aquatic veterinarians, and of course, extension workers for periodic health audits, biosecure farm design, separate archery grows out, and others. In summary, robust biosecurity program, combining good water quality, controlled stock movement, proper disinfection, and continuous health surveillance remains the most effective, sustainable defense against bacteria, parasitic, fungal, and environmental diseases that can catfish farming. In conclusion, it's important to understand that diseases can affect production by at least 20%. In my experience, much more. You can detect diseases through early detection through clinical observation, microscopy, water quality checks, effective management. You need to offer prompt first